Hi, everyone. I'm Dr. Kathleen Mathieson, Program Director of Health Sciences, and I'm here today with Dr. Elizabeth Williams, one of our fantastic alumni. Welcome, Elizabeth. Thanks for being here.
Thank you for having me. It's an honor and a pleasure.
Yeah, it's great to see you.
Thank you. You
Um,
too.
I'm excited to talk with you a little bit about your experiences in the program. You have really impressive background at the federal and the local level, and your work has really integrated all kinds of areas, national security, health policy, and law, and that's really complex work. So I was hoping you could talk about if there was any specific lesson or project during your studies that you felt helped you tackling some of those real world policy issues.
Yeah, sure. Great question to kick us off. So thank you. And I would say it's happened on several occasions during my, DHSc studies. And one instance that comes to mind most vividly, I would say, was I think it was during the global health course, and we were studying the social determinants of health, kind of looking at like the United Nations and their framework for development. And when it really clicked into place, the complex web of interconnectedness that exists between, like the levels of health systems, and there's, at the very individual level, families, individuals, and then sort of like the socioeconomic or demographic factors that are affecting them, society, the government, and then like, broader health systems and the global landscape. And we were looking at data from the United Nations Global Observatory and just looking at trends and health outcomes, kind of correlated with various sort of policy decisions. And I had this moment where I just realized that, the social determinants of health and individual factors, I mean, they're really pervasive, and, healthcare solutions on a global or national scale, they really require like continuity of care and sustainable solutions, to show any sort of long-term improvement. And so this made me think about, global aid, and our global health aid programs, some of which I used to work directly on. And so it just kind of clicked that, okay, it's not enough just to airdrop, food or medicine over a country or provide like one-off vaccinations. Like actually individuals are probably better served with consistent access to care over a long period of time. So maybe instead of using, aid donations for like these one-off sort of like events or, vaccinations or whatever, but maybe providing long-term like telehealth solutions or telemed, where they're afforded that sort of continuity of care with a provider, then like delivering food and medicine baskets where it might feel good to us, the aid providers, because we're seeing it, it's tangible, they get the donation and they're happy, but then what are the long-term outcomes and what's the long-term impact? So just, it kind of helped me consider the bigger picture and just understand really the reality on how to get a more effective bang for the buck.
Yeah, absolutely. The 30,000 foot view of
Yes,
things.
thank you.
Yeah, those are really good points. I know you've managed really large budgets and multi-million dollar programs also at the federal level. And I wondered if you could talk a little bit about, making decisions involving those sorts of initiatives and those high level budget matters. Are there frameworks that you use to kind of help you make those decisions? And was there anything in your studies that aligned to that kind of work?
Yeah, absolutely. So I think this was very early on in the DHSc program. I forget the name of the class it was, or the course. It was, I think, like leadership or decision making, something along those lines. But we learned about the SWOT analysis at that, during that course. And so like strengths, weaknesses, opportunities, threats. And that's really stuck with me. It stuck with me throughout the program, which we kind of circled back to on several occasions. But also in my day-to-day job. And so that's kind of like my go-to kind of framework. So, I mean, I just used it earlier this week, actually. Would you like me to share?
Yeah, sure.
Okay. All right.
Yeah.
So for example, we have the situation, I'm working in local government at the moment, and we have the situation confronting, drug use in a public park. And so, looking at different interventions for how to make an impact, like dissuade the drug use, but also encourage public enjoyment and participation and, accessibility of the park. And so looking at what can we do, right? One intervention that's possible is, increase police, visits and surveillance of the area, or we could put up signage. And so kind of going through like, okay, well, say if we increase, police visitation, what are the strengths of that? What are the weaknesses, the opportunities or threats, right? So the strengths are it's visible. It's probably going to be pretty effective. If people are going to be engaging in illicit behavior, they'll see the police presence and might be dissuaded, pretty effective. Or weaknesses, well, it might dissuade the public from visiting the park, right? An opportunity, right? Well, the opportunity is collaboration with the police force, individuals, neighbors in that sort of neighborhood, and then threats. Does that sort of escalate the situation? So just kind of going through each of the interventions and using that analysis, I do that on a regular basis, and that was very helpful.
Yeah, that's a really helpful framework. Thanks for sharing that real life experience. When folks are thinking about going back to school, sometimes one of the important factors is just what the experience will be like at a human level, and especially for an online program where you're not seeing people in person necessarily. Can you talk about your experience with the human aspect and just interacting with faculty and the learning environment and working with other students, and sort of what your experience was like in the DHSc at ATSU?
Okay. So I think that's one of the inherent challenges of any sort of, mostly online program, like at any university, is how to sort of, cultivate that human-to-human interaction and like experience. And so I think initially that was a little bit challenging, but then I think almost immediately I was just so encouraged by the faculty, my advisor. I really actually clicked very well with my advisor, and we had regular calls, and I got to trust her and feel comfortable asking questions, especially when you're navigating this virtual web, right? And I'm a people person by nature, so I'm an extrovert. Like it's kind of natural to me to be outgoing and to conduct outreach. So I just kind of had to be brave and connect with my fellow classmates, and so I took the initiative to like initiate WhatsApp groups or or chat groups, so where if we were in a course, like we had a common space to sort of share ideas and ask questions. And then once I kind of got that ball rolling, it felt really comfortable. It felt like a shared human experience. Just having people to soundboard ideas off of, bounce ideas off of, and if we had common frustrations, instead of burdening you, the professor, for example, all the time, we tried to really resolve questions and concerns at our own levels, which was pretty effective at several points. And I also loved participating in the student ambassador program, so conducting outreach with prospective students. I really enjoyed those interactions as well. So I feel that ATSU kind of provided me that space to connect with others and really expand my network.
Yeah, that's great. I'm so glad you're part of the ambassador program. And you all had a really strong cohort, and you seemed really close when we went through the applied research project, which I think is wonderful. Well, thank you so much for sharing your experiences with us today and taking the time out of your busy schedule. And just much appreciated.
Okay, was there one more question, Dr. Mathieson? Or
yeah, sure. I guess if you have anything you'd like to add about sort of ATSU's DHSc program and if students are considering it, what you think competitive edge it might provide them.
Yeah, sure. So, I think the true competitive edge and value of the DHSc program at ATSU is a diversified curriculum, because you basically get to test drive different facets of, global health, for example, anything from like emergency management to evidence-based practices, and you can pick a subject matter, and then it provides you with the opportunity to, pursue research in an original fashion, become that author, and then potentially, publish, which really does influence, on the global landscape. And so I found several opportunities through the program to pursue a subject matter, really in depth. And I found that there were several opportunities to, become a published scholar in doing original research. So I think ATSU providing that opportunity to students like myself is definitely a competitive advantage.
Oh, yeah, absolutely. That's great. Thank you for sharing that.
Of course, my pleasure.
It was great to talk with you. Thanks again.
Yeah, thank you, Dr. Mathieson. Appreciate this opportunity.